Hi everyone, welcome to PsychWatch, my YouTube channel on various topics in psychiatric nursing, psychiatry and psychology. Today we are discussing about learning disabilities. It's quite interesting for public as well as medical and nursing students. This is specific to public, that is, parents are much worried about how their children are learning. Many a time, parents come to psychology departments or counselors to sort out their problems related to their children's learning disabilities. So one must be clear about what exactly is learning disabilities. And there are certain synonyms related to this learning disabilities. They are learning differences and learning disorders. These are the two terminology usually we can see in literature related to learning disabilities. But one must be clear that it is nothing to do with the learning problems. So learning disabilities and learning problems are two different things. In learning problems, it involves impairment in areas of hearing, vision and motor function. So if your child is affected with some hearing problem, some visual problem or some motor function problem, that can lead to learning problems. Then, in case of emotional disturbances, your child can have learning problem. In case of cultural, economic or environmental problems, your child can have learning problem. Then, in case of intellectual disabilities like mental retardation, your child can have learning problem. So remember, learning disabilities or disorders are different from that of learning problems. Now we will see what are the common learning disabilities. All disorders or disabilities starting with DYS: dyslexia, dysgraphia, dyscalculia, dystopia, dysmorphia, dyspraxia and dysphasia. See, every learning disorders or disabilities are starting with this. There are few other problems that can lead to learning disabilities like ADHD, attention deficit hyperactivity disorder, and autism spectrum disorder. My previous video was related to autism spectrum disorder. Now we will focus on this. In this video we will focus on dyslexia, dysgraphia, dyscalculia, dystopia, dysmorphia, dyspraxia, dysphasia and ADHD. Dyslexia is nothing but it is reading problem. The person, the child, may find it difficult to read exactly what is written in the textbook. Instead of dog, they may say God. So there will be always possibility of interchanging of letters. In case of dysgraphia, the person can read anything but he is not able to write. While writing, they may come across with this problem, that is, instead of dog, they may write God. So that is what is dysgraphia. Then regarding dyscalculia, it is related to maths. They may find it difficult to multiply and or subtract. So all the mathematical functions may not be easy for child affected with dyscalculia. Then in case of dystopia, it's very interesting. You may be familiar with utopia. So in utopia, the person may have excellent, vibrant, unimaginable ideas, utopian ideas. Everybody is familiar. Opposite to that utopia, there is dystopia. That means the person may have minimum self-esteem. They don't have any ideas. So it will leads to learning disability, or it can have problem associated with learning. Then dysmorphia. The person may have difficulty to difficulty to comprehend shapes. That is what is dysmorphia. Dyspraxia is, of course, it is related to problem with coordination, hand coordination, movement coordination. So everything is affected in dyspraxia. So person may not be able to do this coordinated movements if the person is affected with the dyspraxia. Dysphasia is otherwise known as aphasia. The person phasia, something related to sound. The person will not be able to speak properly. Attention deficit hyperactivity disorder, the person will not have any attention, and more the person can have hyperactivity. So we'll see this attention hyperactivity towards the end of this video. Now we can see some of the facts related to learning disabilities. And it's very interesting. In epidemiological studies related to learning disabilities in India, that ranges from 3% to 19%. And on an average, 10% of children are affected with learning disabilities. Among this learning problem, 1 in 5 are affected with dyslexia. Dyslexia is the most commonest one that we can see. The person is not able to read. Disabilities are neurologically based processing problem. It has got some neurological function problem. Then identified via psychological and educational testing. Outcome can be improved with a specific intervention. That is the most beautiful thing related to learning disabilities. You can have a better outcome if you intervene such conditions effectively in an early period. Then can exist in isolation or combination. That is also there. A person can have a single problem and can have multiple disabilities. That also you can see. Learning disabilities interfere with acquisition of skills, executive skills, and can affect social interaction. So this is the main thing as a psychiatric nurse I am worried about. Acquisition of skills related to reading, writing and written expressions, oral expressions, or maths. So these are some of the acquisition skill which is affected in learning disorder. Then regarding executive skills like organization, time management, planning, attention, memory, and analysis skills. So these are some of the area which is affected in learning disorder that we can term as executive skills. Among this, organization, very important. So initially, child may not need this organization skill properly. But as he grows, his organization skills need to be improved or expanded. And in case of this learning disorder, if it's left untreated, there is possibility with this organization skill. Time management. This is the commonest area, commonest symptom that we can see in a person who is with a learning disorder. He will not be able to manage time. And there will not be any planning from the part of the child who is affected with this learning disorder. Attention and memory can be impaired. Analysis skill, because most of the patients or most of the children affected with the learning disorders focus on specific details. They are not able to see the big picture. As I told, as discussed in this autism spectrum disorder, They will not be able to enjoy a forest. They may be more focused on a tree, a branch, even a leaf, except in case of attention deficit hyperactivity disorder, where the person is not able to focus or attend. Then, because of all these reasons, he can have inferiority complex and he may show withdrawn behavior. So, social interactions can be affected in case of this learning disorder. Now we can see the signs of learning disorder. Major signs that we can see in learning disorder, that the child do not make adequate progress and keep up with their peers academically, peers in the school. Most of the children are inconsistent in their ability to understand and complete schoolwork. Many a time, school teachers may complain that the child is not performing homework, and that may be the reason by which parents may be called to the school and teachers may complain about the child is not doing this homework properly. So first thing is not at par with the academic excellence exhibited by his peers. Second thing is not performing activities, that is like school activities and homework activities. If you place the child for some psychological evaluation, they may get scattered scores. There will not be any consistency with the psychological scores or psychological testing scores, but have average or above average IQ. Person can have an average IQ. Sometimes children affected with learning disorders can have above average IQ. That is also possible. In case of a preschooler, the most predominant feature that we can see is problem in pronouncing words. So that is the first step where a teacher or a parent can pick learning disorder. The person is not able to pronounce words properly. Trouble finding the right word. So during the conversation, during the speech process, the child may experience difficulty to pick the right word at the right time. Difficulty in rhyming. In preschooler, we can see if the child is affected with this learning disorder, he may find it difficult to get that rhyming properly. Trouble learning with the alphabets, numbers, colors, shapes, days of the week. So these are some of the teaching learning activity that is taking place for a preschooler. That is, he will not be able to identify the number. He is not able to identify the colors. He will not be able to identify the alphabets. He will not be able to identify the shapes. And he will not be may not able to speak about days of a week. So these are the common academic activity that the child has to undergo in preschool. The difficulty in following directions and learning routines. There are certain directions in the school. When the teacher explains about these directions that is pertaining to the school environment, the child will not be able to follow that direction. Then learning routine. As I told you, the child may not be able to complete his homework or learning activities, learning routine that is present for the child in the school. Difficulty in controlling crayons, pencils, scissors, coloring within the lines. So these are the activities. The child who is with the learning disorder will not be able to hold these crayons properly, use that crayons properly. He will not be able to color within that particular line. He will not be able to hold the pencil properly. He will not be able to use scissors. So these are some of the equipments. These are some of the tools a preschooler uses in preschools. So in case of learning disorder for a preschool, all these areas can be affected. Trouble with buttons, zippers, snaps, learning to tie shoes. All these areas can be affected if a preschooler is with learning disorder or learning disability. In case of a child with 5 to 9 years, he can have trouble learning the connections between letters and sounds. So this is the time child learns about the connections between alphabet and sounds, phonetics. Unable to blend sounds to make words. Confuses basic words and when reading. During that process, he will not be able to pick up that words properly. He may be confused. Then slow to learn new skills. 5 to 9 years old child will not be able to learn new skills. Spells words and makes frequent errors. Trouble learning basic mathematical concepts. Difficulty telling time, remembering sequences. So these are some of the area where the child with 5 to 9 years are affected in case he is diagnosed with a learning disorder. Now in case of a child with 10 to 13 years of age, he can have difficulty with reading, comprehension or math skills. He will not be able to comprehend what he is reading. He will not be able to perform mathematics similar to that of his peers. Trouble with the open-ended test questions and words problem. If the child is giving an open-ended questions, if it is a closed-ended questions, he will be able to answer it because there are specific possibilities, yes or no, or single words. Whereas in case of open-ended questions, he will not be able to perform that questions, or he will not be able to respond to that questions properly. Dislikes reading and writing, avoid reading aloud. So what all situations are there where he need to read, where he need to write, he will skip that possibility, skip that time. And most of the time, child will have a poor handwriting, poor organization skill, like in bedroom, like homework. Desk may be messy and disorganized. His bedroom, by seeing his bedroom itself, he can see it is messy. His tabletop may be messy. So he will not be able to organize things which he is supposed to do at that age. Then trouble following classroom discussions and expressing thoughts aloud. During this period, 10 to 13 years is the time where the teacher may conduct so many discussions inside the class. And a child who is with a learning disorder at this age may not be able to participate in this discussion properly. Many a time they will not be able to say something in front of others. Spells the same words differently in single documents. That is also possible when the child is affected with learning disabilities. So areas that we need to focus is oral expression, written expression, listening comprehension, reading mechanics, reading fluency, mathematical calculation and mathematical reasoning. So these are the areas by which we can pick a child who is affected with a learning disorder. Now, one important area or important type of learning disorder, that is auditory processing difficulty, or auditory processing difficulties can be there for a child who is affected with a learning disorder. Difficulty hearing in noise. When there is noise in the class, he will not be able to listen what the teacher tells. Difficulty following directions. As a student, he has to follow directions. The child who is affected with a learning disorder may have auditory processing difficulties under which he will not be able to follow this direction. Mostly, the child may have poor listening skills. Academic difficulties can be there. All these academic activities are Herculean tasks for him. Poor auditory association. He will not relate what he is hearing. He will not be able to comprehend what he is hearing. And there can be input disorder. That means he will not comprehend and he will not be able to register what he is hearing. That will end up with an academic problem. Executive functions difficulty can be there because of this auditory processing difficulty. Then attention deficit can be there. That can be associated with this one. It can be secondary to this auditory processing difficulty. Language processing difficulties can be there for a child who is with a learning disorder. Here the child can have difficulty getting into the points. He is not able to speak up exactly what he wants to speak. Difficulty in organizing and expressing thoughts. Most of the time, child will have that problem like organizing the contents, organizing the thoughts, expressing the thoughts. All these areas are affected in case of this learning disorder. Difficulty getting started with open-ended questions. Uses vague languages. As he is not clear about what he wants to speak, he can use vague languages. Difficulty knowing what to say. Difficulty reading and responding to social cues. As a child, as a student, he needs to respond to social cues, emotional cues, what he is getting from others. But in case of learning disorder, he will not be able to follow the social cues or emotional cues. Word finding difficulties are more common when the child is with a learning disorder. He will not be able to pick the right word in right contexts. Difficulty in remembering lengthy directions and pronounced differences between performance and verbal abilities. All these things can be there if your child is affected with a learning disorder. Now we can see ADHD, attention deficit hyperactivity disorder. In case of attention deficit hyperactivity disorder, the child is inattentive, distracted, and hyperactive. Attention deficit hyperactivity. So attention is a deficit and hyperactivity is there. Restlessness can be there. Impulsive. Child may do certain impulsive activity. There will not be any impulse control. So he can met with certain accidents because of this impulsivity. Interruptive behavior. Intrusive. When others are speaking, they may interrupt others' speech. They will not wait for them to complete the speech. Mostly the person can burst out with answers, and many a time he needs treatment. In case of dyslexia, the person can have decoding errors, difficulty in segmenting. That means, so when we speak, there will be some segments and we need to decode certain thing. That means when we need to speak, we need to remember certain things, we need to formulate a mental image. All those processes are affected in case of dyslexia. Slow reading, lack of fluency, which can be there in case of dyslexia. Poor spelling skills, lack of recognition. With the same reading passage, he can have this problem. Substitute one word for another. May struggle with the vocabulary. Maths and understanding word problem. May have difficulty in recalling words or both. All these things can be there in dyslexia. Now, why I told this dyslexia right now? Because there is another type of disorder, that is non-verbal learning disabilities. In non-verbal learning disability, the features we explained may mimic in this condition. That is, person can have academic problem, person can have social and emotional problem, and person can have physical problem. In academic problem, he can have good verbal reasoning. He can have comprehension. He may have a better vocabulary. He may have a listening memory. Attentive to details. But he will not focus on big picture. He is more specifically focusing on specific thing. Difficulty with maths, bad handwriting. These are some of the academic features that we can see in a person with a non-verbal learning disability. In case of this NLD, non-verbal learning disability, he can have problem with the social or emotional area. He may be find it difficult to generalize. Application of knowledge is very difficult for such individual who is affected with the non-verbal learning disabilities. Concrete thinking, always he may show concrete thinking. Abstract thinking will not be there in such individual. Social and emotional withdrawal can be there. He may have anxiety. Most of the time, he is with a low self-esteem. So these are the social and emotional area which is affected in non-verbal learning disabilities. In case of this such individual affected with NLD, he may have physical problem like poor coordination, difficulty with direction, difficulty with time and length. So all these things can be there. Now we can see how to manage a child with learning disabilities. For that you need to have a research mind. If you are a nurse, if you are a parent, if you are a teacher, always focus on research, because so many researches are going on in this area. Day by day, new findings are coming to manage a child with a learning disability. Research, detailed researching will help you to identify evidence-based practice. So always keen to learn new things. What is happening in the world of science with regard to learning disability. So research type of thinking or research mind is very important for a person who need to deal a child with a learning disorder. Identify the exact problem, because I told you child can have individual problem, child can have complex problem, or combined problem can be there for the child. So always think about what exactly the child needs, what exactly is the problem the child faces. So that is important. Strength need to be focused. Every child has certain strengths. If you are dealing a child with this learning problem, identify the strength and weakness and focus on the strength of the child. Then home-based intervention is very important, because it is very expensive to manage a child in an institution where one-to-one interaction with the child may be needed in case of severe cases. So home-based interventions are very much effective and is the need of the hour. Focus on the home-based intervention, or teach the parents how to manage a child inside their home, how to teach them, how to train certain skills for the child. Everything need to be trained. Then only we can manage a child, and home-based interventions are very much effective for controlling problem associated with a learning disorder. Then social and emotional skills. Children affected with a learning disorder do have problem with the social skills. He has problem with the emotional skills. So teaching a child social skills, teaching a child emotional skill is the part of management in case of this disorder. And regarding attention deficit hyperactivity disorder, there are possible causes like genetic and environmental factors. It runs in families. Environmental factors plays a major role. Nutrition, poor nutrition by the mother during pregnancy can end up with attention deficit hyperactivity disorder. If the child is with a nutritional deficiency, he can have attention deficit hyperactivity disorder. Brain injury, birth injury, that can lead to attention deficit hyperactivity disorder. ADHD involves the neurological development of the brain cortex and the regulation of neurochemicals or neural chemicals of the brain. So when a child is affected with this attention deficit hyperactivity disorder, think of that developmental problem. ADHD is diagnosed when there is an inability to maintain attention and focus. If the child complains of this inattention for a long period, if the child is with hyperactivity which may affect his normal functioning, you need to think about attention deficit hyperactivity. Transition between tasks. Most of the time the child will have problem associated with a task fulfilling. He may not be able to complete a task which is given to him. Then physically the person will not be able to focus, or physically he may be agitated, hyperactive. He will not be able to follow cues. He will not stand in a queue, he is not able to maintain silence where he is supposed to maintain silence. Then we can see the subtypes of attention deficit hyperactivity disorder. Subtypes are hyperactive attention deficit hyperactivity. So subtypes are predominantly attention deficit, predominantly hyperactive, combined. In combined, the person can have both hyperactivity and attention problem. Now we can see the signs and symptoms. I already discussed in attention deficit hyperactivity, the person may have problem with the waiting in turns, inability to sit appropriately for that age level, high level of physical activity. In case of attention deficit hyperactivity, management best managed through a combination of behavioral and pharmacological measures. Seek support from teachers, doctors, school counselors, and learning specialists. It's a group activity actually to manage a child with attention deficit hyperactivity. Keep channels of communication open. Use preferential seating. Then give cues. Give proper breaks in between. Plan time according to the patient's needs. Pair auditory and tactile visual stimuli according to child's need. Every child has a unique profile of strength and weakness. Depending on learning disorder, combination of learning disorder, we need to identify the strength and weakness. Based on the strengths, plan activity. Focus on the strengths. Give positive reinforcement for positive behavior. Wean out negative behaviors. There are many strategies to assist each student in finding success in school life. It is a family affair. You need to support the family members. Always keep in touch with the parents. Always keep in touch with the teachers, because both of them are closely involved in managing a child with attention deficit hyperactivity. So far we discussed about various aspects related to learning disorders. So learning disorders are otherwise known as learning disabilities. It is nothing to do with learning problems. So based on the child's unique problem, you can identify various management strategies. You may get short answer type questions from this area. Attention deficit hyperactivity can be asked. Learning disability can be asked as a short note. If you have any more comments, you can give it below. Thank you.